Good afternoon, everybody. Thanks for persevering with us and staying for the last session. So I'm just going to discuss the botulinum toxin. This is kind of the level that would be beneficial for people that are about to start their botulinum toxin practice or at a basic level. So we know BT works on the neuromuscular junction, and its use in the cosmetic world is well known. So I'm just going to talk about a couple of small aesthetic principles. So it's essential that you are aware of the complex interaction between all the facial expression muscles. So they don't work in isolation. They're a group of muscles. So paralyzing one muscle, one group of muscle with botulinum toxin may affect other parts of the face. It can alter the position of your brow, your eyelid, your mouth, so you have to take that into consideration when you treat patients. And another principle as well is it's very important to discuss with your patient the therapeutic endpoint of your treatment. So we are generally going away of overdosing people and leaving them with mask faces into more kind of softening and diminishing the line at expression. We're leaving a little bit of fine movement to avoid unnatural looks. So there are different types of wrinkles, as we all know. There's the kinetic one. These are the early ones. They're only present during expression. There's the hyperkinetic ones. They're slightly more severe. And there's the hypertonic one, and where the patient can't relax their muscles and they always have wrinkles even at rest. And it's essential to explain to your patient the slightly guarded prognosis for botulinum toxin in these cases. It will soften their wrinkles, but it will not get rid of it altogether. And I think it's useful to classify their wrinkles. It's useful for your auditing, so you see how much benefit you are achieving, and it's useful to prevent over-treatment, and it's for documentation as well. So there are different grades, and this is a nice scale that you can get online and take photos and just scale your patients according to their wrinkles. So during this talk, I'm going to be discussing the 3 commonly injected sites in the aesthetic world. So I tried to look for some evidence base, because different people inject different sites and different doses. So it's useful for a beginner to have some guidelines as to how much to inject and what to look for. So I'll start off with the forehead. I think this is probably the most dangerous area, and this is the area that we sometimes turn patients away and advise them against treatment. So you have to really pay some attention to their assessment. So we know males have slightly bulkier muscles, they have stronger muscles, and it's important to pay attention for some other details. For example, the position of the brow tends to be flat in men and slightly lower, while arched and higher, especially laterally in females. We've discussed the types and the severity of wrinkles. It's also important to pay attention to particular details in the forehead, for example, the size of the forehead, whether they have recessed hairline, because that perhaps requires a slightly higher dose and more injection sites. And I will discuss the Mephisto sign later as well. One of the problems that you may encounter if you've missed this is the brow position. So it's really very, very important. This is an important message to take out of this lecture, is brow ptosis. You really have to be fully aware of how to assess the brow ptosis and to pick early brow ptosis, and also to assess subtle degree of ptosis. And I'll show you some pictures of that. Look for any asymmetry for 2 reasons. One of them is that you're not going to be blamed for this asymmetry post-injection. Second thing is that you can correct this asymmetry by altering the site and the dose of injections. Okay, and as I said before, photographs are essential at rest and during expression as well. So this is a paper, it's a consensus paper, so a panel of aesthetic surgeons, they met together and they decided the injection size and dosage to avoid probably the 2 centimeters at the lower part of your forehead. And these are the classical injection sites. So if you have an average forehead size, it's the 4 injection sites at the middle. If you have a recessed hairline, then perhaps adding 2 more in the center would help. This is the Mephisto sign. So generally, the frontalis muscle is most active in the center, and some people advocate injecting in the interpupillary zone. However, you really need to assess the function of the frontalis muscle. Some people have overactivity of the lateral part of the frontalis, and these are the people that you have to inject laterally as well. You have to address the lateral zone, otherwise you'll end up with this Mephisto sign. They have a paralyzed middle portion of the frontalis muscle, and the two lateral sides are active. Okay. So if they do, you have to inject the lateral part, and you have to go slightly lower, closer to the brow. We know the bifurcation of the frontalis is different between males and females. The females have slightly higher diversion points. So if they have a central line, then you may have to inject centrally as well. As I said before, brow ptosis, it's a complete contraindication. If they have dermatochalasis, that's another contraindication. You're just going to make it worse by dropping their brow. And it's important to assess for settled ptosis. So this lady has asymmetrical brow position. You always look into this. Why has she got asymmetrical brows? Most likely, it's a compensatory mechanism for a settled ptosis. I mean, she's got obvious ptosis, and that's what she needed without Botox. But even if they have symmetrical PAs but asymmetrical brow, paralyze the brow and see what happens to the ptosis. The crow feet line, these are also commonly injected areas. Obviously, they are produced by the contraction of the lateral part of the orbicularis oculi muscle. They are just under the skin, so when you inject, you have to be just subcutaneous. They're very vascular, so if you go deep, you'll get a hematoma. And they're obviously closely related, as we know, to the levator muscle, so there is a risk of inducing ptosis if you go medially close to the eye. There are different patterns recognized. The common ones are the young females, which are the central fan. Men tend to have slightly bigger lines and more inferiorly, and the elderly ladies, they get the generalized pattern, which is group A there in the picture. So you go basically 2 centimeters behind the lateral canthus, just lateral to the orbital rim, just feel it and mark where the line is going to be. And for people that have general or central wrinkles, you inject there, and then perhaps 1.5 centimeter above and 1.5 centimeter below. If you see a man with predominantly lower fan pattern, then you have to go slightly lower, just superior lateral to the maxillary prominence, and try to avoid going below that, as the next slide says, because you may affect the position of your lip. Your smile may be asymmetrical. And also try to avoid the medial part. I mean, you're not going to inject medially for cosmetics, but avoid the medial part because of the risk of ectropion. And it's essential to observe for lag of thalamus, because it's not uncommon in asymptomatic people to have lag of thalamus, so you can potentially give them more dry eyes and more exposure. And the last site for injection is the glabellar complex. So the corrugator muscle is a very big muscle, very powerful muscle, and it's responsible for producing your 2 vertical lines, the 11 sign, and the procerus is the vertical muscle in the center. That's responsible for producing your horizontal sign. And as I said, it's a bulky and powerful muscle, especially in men, so you often require higher doses, so something like 3 to 5 units of botulinum toxin in this area. And I'm saying botulinum toxin, but I mean here Botox. So all the numbers there are actually for Botox specifically, because obviously different brands have different dosage. Okay, so you can go to the yellow spots are essential. That's where you start. If they have a horizontal line, you give the green area, and if they have a very powerful muscle and a lot of lines and a deep furrow in the middle, then perhaps you have to inject 2 sites within the muscle. Be careful with inducing ptosis with this. The mechanism is different to the ptosis you induce by here, because some of the botulinum toxin may just go into the levator muscle. So you can do things like pinching the muscle, holding the brow, injecting away from the eye, injecting deep into the belly of the muscle, and this will help to reduce the risk of ptosis. So this is what I wanted to cover in those 9 minutes, and just think about what you are injecting. There are different numbers, but it's essential to understand the science behind them and what you're trying to achieve. Discuss the end point of treatment with your patient, and that will determine the dose. Thank you very much.